Hey guys, welcome back to my channel. My name is Deni. So I'm just gonna answer questions related to PACU nursing. But before we start, if you clicked on this video and you're not subscribed, and I need you guys to click that subscribe button. Like, y'all are just watching the video but you're not subscribing, please. Please. So today I'm answering the most common questions I hear about working in the PACU. What it's really like, what type of skills do you need to have, how to know if it's for you, pretty much. Number one question, what is PACU and what type of patients do we care for? So PACU basically just stands for Post Anesthesia Care Unit, and it's pretty much where patients go after they have surgery to recover. And we care for people coming out of general, regional, or local anesthesia. And usually patient, when they come out of surgery, they're pretty groggy and just not stable. So our job is to make sure we monitor them closely and make sure that they recover before they go home or to another unit. So next question, what skills do you need to have to work in the PACU? So you need strong assessment skills, especially with like airway and breathing. You use a lot of like the critical thinking skills. You also need to be good under pressure. So critical thinking, good time management, and quick decision making is critical in the PACU. You also need to know how to be calm under pressure because a lot of things can go wrong and you can't be like all over the place trying to care for a patient who is critical. You also need to have emotional intelligence, I believe, because a lot of patients are coming in, they're scared, family have anxiety, crying happens a lot. So you have to be able to kind of know how to care and handle people who are emotional without you also going down with them, if that makes sense. So the next question is tying to the skills that you need to have. Having IV skill is very important, but I also work in pre-op and I noticed that we don't do a lot of IVs in PACU because patients are already coming to PACU with their IVs. Sometimes they come with 2 or 3 IVs, and in pre-op we place a lot of them. So pre-op is very critical. You know how to place your IVs, but PACU, you can get away with not really being a pro at placing IVs, but you do need to know at least how to do it just in case an IV was pulled or something like that and you need to put one immediately, because most of our medications that we give in the PACU goes in the IV because most patients, like I said, when they come out, they're unable to eat right away because they just had anesthesia or they had a tube down their throat, so their throat is sore. So you can't give them pills right away until they're more awake, and in the meantime we have to use an IV to give them pain medication, nausea medication, and just things like that. So you do need to have IV skills. What's a typical day or shift like in the PACU? So pretty much, just in a nutshell, you go in, you make sure all your supplies are in the room before you get handoff from the charge nurse, and they tell you about the patient that's coming. Then the patient comes in with the anesthesiologist and the surgeon. Sometimes you'll have like the resident with them, but for the most part it's the surgeon and the anesthesiologist. They come in, they give you handoff on what they did, and then the anesthesia give you handoff on what type of medication that they got and blood loss and all the stuff, just the history of the patient. And then you get the patient situated, you get their vitals, assessments, and then you just start managing their pain, their nausea, make sure they're stable, make sure their incision or whatever that they had operated on looks good. And then once they recover, as far as like they meet the PACU discharge criteria, they're not having any pain, they're not nauseated, their tube sites are pitted intact, their incision looks good, they're alert, all that stuff. Basically they meet their baseline prior to surgery. Besides, obviously they're going to still be in some pain. Then you can discharge them to either home or to the unit depending on their order. The patient usually don't stay in the PACU for long. Sometimes they're there for 30 minutes. It used to be we can't release them until at least an hour after they've been in PACU, but now it's like we can release them after 30 minutes or whenever they recover. I like to keep our patients just a little tiny bit longer depending on the type of surgery they had and how they're recovering. But anyways, you can keep them for at least 30 minutes to 2 hours. And obviously that is not set in stone. Some patients stay way longer than 2 hours, but that's the standard. Some days there's constant turnover, so like you're getting patients literally back to back, like you discharge one and then another one comes right away. And the maximum patients you can get in PACU is 2, and minimum obviously is 1. Okay, so next question is, how is PACU different from ER and ICU or med-surg nursing? So I really can't speak on ICU or ER because I've never done either one. I worked in the ER when I was like a patient care tech, but that was a long time ago. And I've never worked in the ICU, so I can really just say, how is PACU different from med-surg, because I did a contract in med-surg. I would just say I feel like it's more similar to ICU and ER from what I hear. But it's short term. Med-surg, you're doing a lot more for the patient, whereas, and you get more patients too, whereas PACU, you're only doing just the standard specific things for the patient, and they're not there as long and they get to go. So it's pretty much a mix with more like a surgical recovery focus, if that makes sense. So how do you handle emergencies or complications in PACU? You have to be ready to act fast. So a lot of things that I've noticed happen in PACU is mostly like low blood pressures or like severe pain, and you do have to be ACLS certified. And if things go wrong, we pretty much call the anesthesiologist or the surgeon if needed and intervene. Just stay calm and follow the protocols that your hospital usually would teach you. So what are common medications that we give in the PACU? We give a lot of antiemetics. So IV opioids like fentanyl, morphine, Dilaudid, and then antiemetics, we give a lot of Zofran, Phenergan. This doesn't happen as often, but we do also give reversal agents like Narcan if we give too much opioid. And sometimes we do give like blood pressure medications if the patient comes in and their blood pressure is really high. We give them like hydralazine or labetalol, or if their pressure is really low, we give them like boluses of fluids. And if they're going to the unit, we do give them like, we start IV antibiotics depending on, you know, the order and stuff like that. So knowing medication effects and the timing of the medications is a big deal. Okay, so the next question is, PACU stressful, and how do you manage the pace? For me personally, since I've worked PACU and pre-op, I think comparing the two, PACU is a little bit more tasky, like a little bit more to do in PACU than in pre-op. But generalizing just like PACU and working inpatient, PACU is definitely not as bad. It's not as bad at all. It can be stressful because like if you have fast turnover and you have constant patients in and out, you're juggling a lot of critical patients in a short amount of time. It can get a little bit overwhelming, but for me personally, I think it's only overwhelming to me when it's a lot, like a fast turnover. As long as you're organized and you try to prioritize situations and don't let things kind of get too overwhelming. That's one thing I had to learn when I first started working, is just like one thing at a time. And if you feel like you're behind and you're stressed or whatever, that's why you have your charge nurses, you have your float nurses, manage the pace and the stress so you're not feeling constantly overwhelmed. And just ask for help when you need it. This is one of the biggest questions I kept seeing. I keep hearing people say, do you need prior ICU or ER experience to work in the PACU? I've never worked in the ICU and I've never worked in the ER, but I work in PACU. So do you need the experience? Not necessarily, as long as you've worked inpatient and you know how to time manage and prioritize and be under pressure and all these things. A nurse can work literally anywhere because they train you and you adapt. So I can't speak on like, I don't think you need the prior experience, but I feel like obviously if you worked in the ICU and then you come to PACU, I think it would definitely help, because there's certain things that I've seen in the PACU that I'm like, whoa, I've never seen or heard of this before. And now I have to learn about it. So I've never handled like vasopressors or even like BiPAP machines. Sometimes, like completely honest with you guys, I never handled that until I started working in PACU, and I was like, oh my gosh, having ICU and ER experience can definitely help you get in PACU quicker, in the sense of like learning faster and like kind of knowing the flow. But if you don't have those experience, you can still work in PACU and you can learn. What's the best and hardest part of being a PACU nurse. So the best part for me personally is honestly when I see my patients, and it might sound like a cliche or whatever, but this is literally what I noticed with myself. When I see my patients come in, and I always tell people they come in to PACU and they're hollering, they're crying, they're literally in so much tear because they're hurting so bad and they didn't think their pain is ever gonna get better. And I start giving them the medicine, just giving them their medication and treating it, and then going over their discharge instruction, just seeing them be like a whole new person, how grateful they are and how appreciative they are. And they're like, oh my gosh, I did not think like this pain was gonna get better, and you helped me manage this pain. I feel like that's the best part, because you just see them from when they come out, they're crying, and then they're not in a lot of pain as they're about to go home or back to the unit. And it's a good feeling for me. The hardest part I would say is it being unpredictable, like being in PACU, because you never really know what you're gonna get, especially if you work in a big hospital. You see so many different things, and sometimes it's so many surgeries out there that you just don't know what you're gonna get or what can go wrong. So you just have to always be ready. That's probably the hardest part, is like you always have to be ready to expect the worst. But some people will say that's what makes it exciting. So the other question I almost forgot was, somebody asked if you can work in both PACU and pre-op. Yes, you can do both. I've been talking about it. That's what I do now. So you can definitely do both PACU and pre-op. And the other question I also got was, what kind of shifts can you do in PACU? You can do any shift in PACU, at least the hospital I work at, and most other hospitals I know. You can do 4 10-hour shifts. You can do 5 8-hour shifts. You can do 3 12s. And you can do like part-time, obviously, full-time, PRN. So there's a lot of different shift options, especially if you talk to your manager too. They can collaborate. You guys can collaborate and come up with a shift that works for you sometimes. But the standard shift is 4 10s, 3 12s, 5 8s. Pretty much that's what you can do. So, and the last question, I would say, what advice would I give to a nurse wanting to work in a PACU? One, start by getting strong assessment skills. IV skills is important. If you have interest in working in the ICU or ER, definitely go and do that. But if you don't have interest, you don't have to do that. Med surge, you don't have to do that either. You do not have to. But if you do have interest and you want to, I would say go to med surge, because you see so many things, especially a lot of surgeries, or neuro floor or ortho, like any floor that deals with surgeries. That would be another good place. But obviously med surge gives you a wide range variety of everything, so it's not a bad place to start if you want to start somewhere else before you go into PACU. But if you want to go straight into PACU, do that. But I'm not even gonna lie, it's gonna be a little stressful for you. It's gonna be a huge learning curve. Even me coming from step down cardiac to PACU, it was a huge learning curve. It was a lot of things and it was overwhelming. Ask to shadow PACU in the hospital before you decide to work in the PACU. That's what I did. It helped a lot because I got to see kind of the flow of what a PACU nurse does, and I got to talk to some nurses that work there, and everybody that I talked to at the time, for the most part, they seemed happy compared to where I was coming from. So also learn to just recognize like patient trends, learn to just be ahead of the game, like anticipate bad things happening so that you are ready when things do happen. Not saying that you want bad things to happen every time you're at work, but as a nurse you do have to anticipate bad things happening, like complications, so that you're aware and you're ahead, so that if it does happen, you kind of beat it in a way. Learn to advocate for yourself. Don't be afraid to ask questions. If you do need help, ask for help. Don't go and do something that you're not sure how to do, and do it anyways. If you don't know how to do something, ask how to do it or research how to do it first before you go do it. So just be a better communicator if you're not, because we work with a lot of like different teams, like anesthesia and surgeons and CRNAs. So learn to communicate with people and just learn to deal with a lot of different personalities. Obviously in nursing there's so many personalities. You have to learn and know how to just handle those personalities. So that's the advice that I will give you guys. Let me know if you guys have any more questions down below. It's fast, it's intense, but I think it's an incredible place to work, especially if you're looking for that soft life nursing. So if you like this video, please give it a thumbs up and don't forget to comment down below, like I said, any questions that you guys have. And please hit the subscribe button. Don't forget to watch my other videos here related to my travel nursing journey. And I'll talk to you guys later. Bye.